Welcome. Thank you for joining us for the first webinar for the Collaborative Research Center for American Indian Health, also known as CRCAIH. My name is Danielle Kenyon. I am the Program Director for CRCAIH. I help the Principal Investigator, Dr. Amy Elliott, with the administration of the grant activities and head up the Pilot Grants Program Subcommittee. We want to let you know that this webinar will be recorded for future use. Right now we have everyone on mute, and then for the question and answer portion, we will unmute your lines for questions. We will hold questions until the end, but feel free to type in your questions in the box at any time. These slides will be available on our website, crcaiih.org, for future reference. So to give you an overview of this webinar, first I will give a description of the Collaborative Research Center for American Indian Health overall activities. Next, I will detail the Pilot Grants Program purpose and process, including deadlines and important dates. Then several of our team members will give an overview of the division and core resources available to pilot grant applicants and to pilot grant awardees throughout their project. Although CRCAIH has several functions and activities, our focus of this webinar is specifically on the support services for the Pilot Grants Program. Then finally, we will conclude with the question and answer period. The Collaborative Research Center for American Indian Health is designed to create a common ground to bring together people of multiple disciplines to work together to improve American Indian health in North Dakota, South Dakota, and Minnesota. This includes folks from tribal communities, healthcare organizations, and research investigators to work together in raising awareness of American Indian health disparities and in designing and implementing cutting-edge research that addresses these disparities. There are two major ways in which CRCAIH addresses these health disparities through research. One is building tribal infrastructure to do research and regulate the research that goes on in each tribe. Currently, we have 4 tribal partners with CRCAIH throughout the North Dakota, South Dakota, Minnesota region. They are Ogallala Sioux Tribe, Cheyenne River Sioux Tribe, Turtle Mountain Band of Chippewa, and Fond du Lac Band of Lake Superior Chippewa. With these partners, we are focusing on activities such as building community engagement and research, and building tribal research regulation, such as research review boards. The second major overarching activity of CRCAIH is support of solid research on social determinants of health for American Indians in North Dakota, South Dakota, and Minnesota. We do that through support of 3 large research projects in the research division that you can see on the triangle, as well as in the Pilot Grants Program mechanism we are focusing on today. What's wonderful about CRCAIH is that we have the resources to support these activities like the Pilot Grants Program. Through our divisions and cores, we can help build the expertise and skills of investigators in our region. The purpose of the Pilot Grants Project is, as previously mentioned, one of the strengths of our center is the transdisciplinary focus. What we would like to see with the Pilot Grants is a creation of teams with people from multiple disciplines coming together to approach a problem, utilizing each person's expertise and experience in their field, and building from that to create an approach that is unique. As we all know, American Indian health issues are complicated, so they require a multifaceted approach. The second thing we're focusing on is projects that involve looking at social determinants of health. This would include pretty much all types of research outside the basic sciences, such as looking just at mechanisms or genetic predisposition to disease. Social determinants of health includes research on individual and community behaviors, as well as social conditions, including economic factors, socio-political conditions, environmental, and cultural factors. We see the purpose of the Pilot Grants Program is the opportunity for organizations and investigators to get data for research questions they have, and then to utilize that pilot grant data to apply for future funding mechanisms. We also like to see that research knowledge gained and have the data help drive what we know about American Indian health forward in the research literature. So to give you an overview of the Pilot Grants process, this is our second round of funding through CRCAIH. So we were able to send out the RFA and forms a lot sooner than last year. They're very similar as they were that first year. So we released the RFA and application November 11th. So this gave people a little over 3 months to prepare their application. The letter of intent is due January 27th, and it's encouraged but not mandatory that you submit that, just so we can get an idea for our external reviewers what types of grants to expect. The big date to put on your calendars is the application is due February 24th, and then we have about a month and a half set aside for review for our external review panel. And we anticipate about mid-April that we would be contacting the awardees for a little bit more information and then sending out that information for NIH review. The funding for these projects begins August 1st, 2014, and for a year-long project. If you haven't seen them yet, the RFA and application are on CRCAIH.org/pilotgrants. The application is a Word document that's a fillable form. So now I will transition to detailing the role and services of the Administrative Division. The Administrative Division of CRCA was created to provide leadership and guidance in all areas of the grant functioning and to promote transdisciplinary research. We do a lot of facilitation of partner engagement and try to ensure bidirectional communication throughout the center and with our external partners. Again, our purpose is to communicate with the centers within and throughout, so we have a lot of management throughout the Administrative Division. This is where our evaluation services with Emily Whitehat are housed. We have the pilot grant mechanism to promote research that we're talking about today, and then our annual summit, which will be in Bemidji next June. So some of the Administrative Division service examples that we had this year and from last year, a lot of the questions come to us first just to talk about what is the investigator eligibility and if their pilot project idea fits with the scope and mission of our pilot grants that I detailed earlier today. So talking through the transdisciplinary approach to social determinants of health of American Indian health in North Dakota, South Dakota, and Minnesota. A lot of what we do is discuss how you can emphasize important elements of the proposal. Some of you I know have submitted grants the past time that we held them, so we can help discuss the responses to reviewers you got last time and help you try to approach those. We are always here to assist in talking through your research questions and hypotheses and help you scale your design to fit that budget of $25,000 to $80,000 a year, and that the scope of your research question fits that scale design. As I said previously, we're always here to connect interested investigators, so if you have an idea of a topic but are looking for a community or an academic partner that would be interested in the same, we're here to help connect you with other folks who may be interested as well. And again, that our evaluation services are with the Administrative Division, so we can help in assisting you with your logic model design or your development of your evaluation plan and measures. Next, I'll hand the baton to Jen Krasik, who will be speaking on the Community Engagement and Innovation Division.
Thank you, Danielle. Again, my name is Jen Krasik, and I work alongside Dr. Victoria Grayle and Roxy Miller here in the Community Engagement and Innovation Division. Our division is committed to engaging communities to help establish American Indian health priorities and building the community capacity for research by increasing knowledge and trust in research. So what does that mean in the context of the pilot grants? As you can see on this slide, our services, just like our other cores, paint a pretty broad stroke. And before I begin, I would like to just note that it's entirely possible, and it's very possible actually, that you will need to contact more than one of us, meaning the different cores, to get all the answers that you require. And that's completely okay, and it's also entirely possible that your project will require collaboration between some of the cores as well in order to get you the best answers. So here's some of the examples of how the Community Engagement and Innovation Division can assist you throughout your pilot grant application. Number one, discussion of interested community collaborators. If you are a researcher and you have a really good idea, but you don't know A, how feasible it is, or B, who'd be interested, or C, how to find out who would be a good community to partner with, our division can help talk you through these questions. Actually, a lot of our phone calls last year were simply listening to your ideas and bouncing ideas back and forth. Providing input on how to utilize community-based participatory research methodologies. This is also commonly known as CBPR. And the first step in utilizing CBPR is understanding what it is and to what extent you would like to implement it into your project. We can help you out by giving you resources to learn about community-based participatory research and then talking your project through. So how does this method apply to your project and how can it be integrated into the project and to what extent? Providing basic information on community partners. It's always a benefit for you to learn who you may be working with, and it also shows the community that you are invested in working with them. One of the most frequently used services was this, where we were just providing this basic information. And much of this information comes through our conversations. So it's not a formal document, but just really learning about your project and how that would help us know what we need to provide to you that would be the most beneficial. Assisting with making introductions between an applicant and the community collaborators. We heard a lot of great ideas last year, and there were a few times when the researcher just wasn't sure how to proceed. And that's where we stepped in. We made a few phone calls, we emailed introductions, and in a few instances we started all over and made different introductions. For example, last year we had a researcher who, after the introductions were made, and she explained her project to the community partner or potential community partner, was told by the partner that while her study sounded interesting, they just were not in a position to be able to consider it at that time. So we went back and took another look at some other potential partners and made the introduction process all over again. Providing input on essential steps in collaboration. This goes along with our previous example. As you move along the process to get your application ready, it's necessary to consider your steps during the application process and once the study gets underway. We can help you identify some of these steps, but more importantly, hopefully we can get you connected with a collaborator who will help you along these lines and will work alongside you to help make sure you know what needs to be done and how it should be done. And last but not least, reviewing an abstract or some of your grant pros and providing some feedback. This was a popular one with all of the cores, and we are happy to assist you during your writing process by giving you a second look at your specific aims or doing a read-through of your proposal. And I will add that we can offer this as our time allows. And as much fun as I have reading through some of these projects, the amount of time it takes can be consuming, so we will have to exercise discretion on how much time we can focus towards that. So these are just a few examples of the services that we can provide. Our division is very excited to work with you, and we look forward to learning more about your ideas and how we can help. And with that, I will pass the focus over to the Regulatory Knowledge Corps and Jyoti Engel.
Thank you, Jen. Hello, everyone. My name is Jyoti Engel, and I'm the Director for the Regulatory Knowledge Corps, and work with Mana and Dalcio as a Corps Coordinator. So as the name suggests, this Corps is responsible for providing support to investigators as they navigate the regulatory requirements surrounding research. Another significant goal for this Corps is to work with our tribal partners and facilitate the development of a systematic tribal research regulation process. So if you look at this diagram, it has 5 key focus areas for the Corps. But from a pilot grant applicant perspective, I would say that the regulatory support and education training are the most important areas. And I'll talk through some of the regulatory core service examples or some of the questions that we've answered through last year's pilot grant process. So often investigators have a question for how many IRBs need to review my protocol. And this can be particularly challenging when you have a research project that is multi-site. So if you are working on your grant application and have run into a situation like this, feel free to give us a call and we can help you talk through that process. The second question about where would I find materials, this is often something that would come after you would find out the funding decision. But believe it or not, sometimes IRB documents can be quite hard to locate even on well-established institutions. So Sanford IRB, for example, does not have its document on its Sanford Research website. They are on its intranet, so that's something is always challenging, and feel free to contact us if you're looking for help on how to find some paperwork. Another question that came up is how do I reduce my IRB review burden?
And one of the things that we've helped in the past is identifying which are the IRBs that are in the pool, and how can we help set up agreements between these IRBs so that you do not have to submit to so many different IRBs. Questions that have come up are also related to ethical questions around study design. So when you're writing your informed consent, what are some of the questions that might come up that you would need help with? Feel free to call us. Is the incentive that you're giving to a participant, is that adequate? Or how can I use previously collected data for my study? Another question that is not on this slide, but what did come up in the past, is related to the human subject section on the grant. As investigators, specific aims is always our key focus, and the human subject section tends to be the one that is written closer to deadline. But it is an important section, and if you have questions on what you need to include on that, or if you need a second set of eyes to look at that section, we would be happy to review that for you. Again, I reiterate, please give us a call if you have any questions, and we are here to help. With that, I'm going to pass the baton to Susan Pumala with the Methodology Core.
Thank you, Jyoti. So as Jyoti mentioned, I'm Susan Pumala, and I'm the director of the Methodology Core. And I work on the core together with Katie Burgess. So overall, our core is really a utility to support research activities. And what we do is we work with our partners to help figure out how we can best help them build research capacity and develop infrastructure. So we're working closely to identify needs and try to meet those needs through education, training, and consulting. And what our hope is really through our core is that we'll be able to make research methods more accessible to our partners, kind of demystifying them and really making it empowering for researchers and prospective researchers to be able to use research methods on their own, or at least understand them effectively to work with collaborators. So as I mentioned, our primary goal is really to help develop tribal research infrastructure and build research capacity. So we have 4 different kind of areas of services that we offer: education and training, data management, research design, and data analysis and presentation. For the pilot grants, some of the things that we thought would be particularly relevant are listed here. And the first thing that I wanted to point out is a lot of people struggle with the study design, outcome design, and measurement issues. And so we can really help you work through those, especially if you come to us at the beginning of kind of your thought process when you're putting together your grant proposal. Once you have those down, you can do everything else as far as your methodology for your grant. And we can help you along the way too. So once you have your research question and your measurement outcome designed, then we can help you calculate an appropriate sample size for your study so that you can make sure you have the data to answer your research question. In this, you want to make sure that you have the number of participants that you need, but you don't overshoot. So your research would be more expensive, but you don't want to undershoot because you really want to make sure that you answer the question that you want to at the beginning of the study. One of the main things that we can do too is review your grant, your abstract, and your prose. Again, as Jen mentioned, we have limited resources within the core, so I would really encourage you to contact us early if you want some of our help with some of these services, so we can make sure we get you on our calendar and schedule enough time to work with you. Then, in addition to helping you design and kind of write up the parts of the grant that are needed, we can help you with analysis of your study at the end of your project and help prepare reports and do some interpretation of your completed analysis. Overall, I recommend just everybody applying for pilot grants to get in contact with the Methodology Core to discuss your design and analysis. And even if you have a lot of experience doing grant writing, it still might not hurt to have another set of eyes look at your proposal and give you some feedback. And again, one final plea, please contact us early and make sure that we can get you on our calendar so we can offer you all the services that we have available. And with that, thank you so much for your time. Good luck with your grant, and I'll pass it over to Jenna.
Great, thank you, Susan. Hello, this is Jana Prasic with the Culture, Science, and Bioethics Core and the manager with Medicine Wheel Incorporated. The role of the Culture, Science, and Bioethics Core is to assist our internal and external partners in developing and increasing community-based participatory research. The role of the Culture, Science, and Bioethics Core is to develop an educational training model that will integrate educational materials, protocols, and codes of etiquette that are specifically targeted for tribal communities as well as the health researchers going into those communities. Some of the services we provide are training to communities and health research organizations to better understand the history of research and culture to establish and support a solid research relationship going forward. For example, during the pilot grant process, some of the items that we can provide input on is the relevancy of research with tribal communities and designing the project to be more culturally relevant. In year one, we had a lot of great ideas for projects. Some of them were centered on the community and some were not. Some of the assistance that we can offer is to help you determine whether or not the research you're proposing is a good fit for the community. Keeping in mind, it's important that the research fits the community and that we aren't trying to make the community fit the research. We can also provide input on observing cultural protocols in research. This is important. First, what does it mean? And second, how does it apply? Basically, it means learning and acknowledging the social values of the community. It's important to learn what you can because it can impact everything from how you propose your project to how you end up designing it. For example, if a study involves infants, maybe their napping patterns, then understanding the importance of children within that community is essential. However, even more vital is knowing how important the relationship is between that child and mother, grandmothers, aunts, etc. Another example is the impact of research. This is not the same as outcomes. Outcomes are the result of the research. What we can help you examine is the effect your research will have on the participant or the community. Last year, an idea in the area of trauma was presented to us and we were asked for some feedback. The purpose of the study was to determine triggers, and in some cases, the participants would be provided therapy. The questions we posed were, why this population? What about the participants who don't receive therapy? And ultimately, how will this study benefit the community you want to engage? As a researcher, you do need to be able to answer these questions because the community will ask, and they will weigh the benefits against the drawbacks, and they will also hope that you have done the same. We can also advise on approaching communities. If you are an investigator or if you are an investigator that has not worked in a particular community, you may need assistance making connections. Along with the Community Engagement and Innovation Division, we can lend you a hand. We can assist you by preemptively answering questions such as how to keep a project sustainable, or provide examples of logistics and feasibility of working within communities. If you can answer these questions along with others, it can help you find out if your project is a good fit, where it would be the best fit, and finally the most appropriate ways to approach the community and design your study. So I hope this gives you a good overview of what we can assist you with, and we look forward to hearing from you.
Great, thank you, Jana. We would also like to thank our funders at the National Institutes of Health, the National Institute on Minority Health and Health Disparities, and as well as all the people you can see who are currently involved or who have been in the past. Truly, it has been a collaboration. So now we would like to unmute your lines for the question and answer period. And first, we will look at the typed questions. All right. So the first question we pulled up is, what is an IRB?
So an IRB is so it stands for Institutional Review Board. So it is basically a committee that reviews all research done with human subjects. And every institution has an IRB. And so anytime an investigator is conducting human subjects research, you need approval from an IRB before you can do that.
So I am seeing the next question. Should the grant come from the tribe or the researcher? So great question. I'll I'll start that answer, and then anybody feel free to chime in. So what, as I talk through with people who the appropriate principal investigator is, or co-principal investigator, and then the other roles and support staff on the application, it really depends on what makes the strongest team. So a lot of times, so a question that I get a lot is, does the principal investigator have to have a PhD? And my answer has been no, but it's our applications last year were very competitive, that all of the awardees last year were PhD level folks. So that, you know, it would, as I talk through with people, it would behoove folks to put together the strongest team that you can. So whether that means that the tribe, someone at the tribe is the PI, or academic partner researcher is the PI, it would really depend on what you think makes the strongest application. And I would say the PI should show that they can lead the grant and all the activities of the grant. So whether that comes from an academic partner or a tribe, I think that that would be a strength, and that depends on who is best for that specific project. So I'd be happy to talk with others. So one of the questions I see is, can we submit a grounded theory approach or a qualitative approach in qualitative methods? Or is the funding opportunity geared towards more evidence-based models? That's a very good question. I myself am a mixed methods researcher, so use quantitative methods and qualitative methods. And I know the projects that were funded last year had both approaches as well. So we don't have anything stipulating that it should be a quantitative or qualitative. So as long as there is support and you detail your methodology in a strong way, I think that the projects can be either. So again, I would be happy to talk through with folks if they think their grounded theory approach would be a good fit for the program or not. But just looking at the question, it would definitely be an okay approach.
This is Dottie from NIMHD. I just want to make one small comment and suggestion. It may actually be more for you all as the administrators than for the applicants, but just to remind people that in human subjects research, you need to have targeted and planned enrollment tables. That is, you know, how many people, each male and female and whatever race, ethnicity you're going to recruit into your project, and just not to forget that as part of what you submit as your grant packet.
Thank you, Dottie.
An application packet.
Yes.
Sure.
And the planned enrollment tables are within the application, that Word document that you will find. And if you need help in filling out all of those forms, we know that there's a lot of details that go into these grants, please contact us. So we have on this last slide the overall contact information for info@CRCAIH.org and the overall phone line that goes to Leah. And she will help distribute your questions to the folks that that you are trying to reach. So whether it's someone in regulatory, methodology, culture science, and bioethics, you can start with the information here and go from there.
Can I ask a question from Fargo?
Yes, please.
Hi, this is Cornelius Dyke in Fargo. My question is, if we have a project that has more than a single-year time horizon, how is that best handled? Assuming we talk to you beforehand and get some feedback, do grants, can the money, if granted, be used over more than a one-year horizon?
Good question. So what we're looking at is funding 1 year of pilot grants. So it would have to fit 1 year. And what I would do is take a look at your aims and see if you can do 1 or 2 aims that would fit the 1 year timeline that we've outlined in the pilot project.
Okay. Okay, thank you.
Yep. And there is room. We do offer an application for carryover, but that wouldn't be included in your overall design. And it's not guaranteed.
Okay, got it. Thank you.
Yes, thanks. Well, thank you so much for attending our first CRCA webinar. We hope you'll consider attending the next two on writing a pilot grant, which is January 8th at 2 o'clock Central Time. And the next one is pre-application technical assistance with our grants office on January 21st at 2 o'clock as well. And you will see the contact information. Please contact us, and as Susan said, the earlier the better, so that we can have discussions and help you make the strongest application possible. So please consider applying for the pilot grant, and we look forward to hearing from you. Goodbye.